Hello and welcome to this month's Society Chat update. First, I'd like to call your attention to the extended deadline for the 2023 Annual Scientific Meeting abstract submissions. We've been able to extend it a little bit, as much as we could, and abstracts should now be submitted by October 23rd. I encourage you to visit the FACRS.org website to read the available submission categories and presentation formats. Submitted abstracts are really the lifeblood, or one of the lifebloods of our organisation. The impact an abstract presentation has had on careers, gaining visibility, interactions among colleagues, but perhaps most importantly, contributing to both the meeting and advancing the clinical or basic science research in that field. Please get abstracts in. We're really excited about what next year's meeting will look like. Next month, I'll be joining colleagues in La Jolla, California for the very long-awaited Surgical Leadership Institute. A special shout out and thank you to Drs. Sonia Ramamurthy, Kirsten Wilkins, Tracy Hull, Sharon Stein, Steve Sendovich, Kyle Colon and Heather Yo for putting the program together. They've developed a great schedule and agenda, and it includes an opening keynote from Tom Gehring, well-known teacher, author, and management and leadership consultant. Also joining is former NFL place kicker Ralph Benirschke, who will also be providing a patient perspective. There are still a few open spots left if you'd like to join us, and the meeting will be happening just before the American College of Surgeons meeting. I look forward to seeing many of you there. So moving on to this month's committee update, it's going to be from the Healthcare Economics Committee, which is currently chaired by Dr. Kelly Tyler. This committee does a huge amount of work helping us develop new codes for procedures and having our work appropriately reimbursed, while also interacting and working with many other societies and groups across the country, such as the RUC, which you'll hear more about later. So with that, I'll pass you over to Dr. Tyler, and Kelly, welcome, and look forward to hearing from you about the committee and some updates.
Hi, I'm Kelly Tyler. I'm a colorectal surgeon and I live in Suffield, Connecticut, and I practice just over the state line in Springfield, Massachusetts at Bay State Medical Center, which is a branch of UMass Chan Medical School. And I am the chair of the Healthcare Economics Committee of the ASCRS. The mission of the Healthcare Economics Committee is quite broad. We track important issues in national economics, legislation, regulatory issues, and what we do is we keep track of those, we report back to the society on those, and we have touch points in certain organizations that allow us to participate in advocacy. One of our other important missions is educating you as our members through various means such as the meeting and webinars. One of our crucial pieces of work is serving as a reporting entity for our members who participate at the AMA, and they report back to us on their activities. We're actually involved in 3 different committees of the AMA, which are the House of Delegates, the CPT Committee, and the Relative Value Scale Update Committee. Our participation in these 3 committees is quite important. For instance, at the RUC, that group comes together to piece together how to value a physician's work. And that directly translates to the AMA making recommendations to entities such as CMS or Medicare on how we get paid for our work. You may have seen our legislative updates for the DCNR, which come out periodically every few months. And those are generated by members of our committee as we try to provide you with timely information about important issues, not just in legislation, but what's going on with economics nationally, what might be going on at a basic level in practices, so that you're up to date and understand what's going on in this rapidly changing environment. We also participate in the Surgical Care Coalition, which is formed by several societies to advocate at a national level for issues that are important to surgeons. You may have heard of them, and what we've done as the ASCRS is we've participated and contributed to advocacy efforts, and our Healthcare Economics Committee keeps track of what is going on. We participate in meetings, we report to the ASCRS Executive Council, and certainly advocate for our members and the issues important to them. One example would be the recent CMS cuts that were avoided, where the Surgical Care Coalition has advocated nationally and tirelessly to avoid those. Another important initiative is education. We have education at the heart of what we do, and we want to educate you as members. Some of the ways we do that are by symposia at the national meeting, and you're certainly welcome to look back through the agenda and review some of those. And we also have provided periodic webinars, which are saved on ASCRSU if you'd like to look at those. Finally, a really important source of information for you will be at the ASCRS website. We do have a healthcare economics tab under the healthcare provider tab, and you can look at that and it'll provide you with links to explain a lot more of everything I've gotten a chance to talk to you about today. Being a member of the Healthcare Economics Committee and then having the privilege of becoming the chair has been a really great experience for me, and I would encourage young members to get involved. Not only was I able to learn a lot in my beginning years, but now I've been able to lead and mentor and certainly learn from our leaders. It's a priceless experience.
Thanks so much, Dr. Tyler, for joining us and letting the membership know what you're working on with the team and talking about the committee in more detail. ASCRS' very own Gut Check podcast had nearly 1,000 downloads in its first month, with listeners from 48 different countries. The show is already beginning to make the Apple Podcast charts around the world. Be sure to subscribe wherever you listen to podcasts to receive alerts when new episodes are released. I want to thank you all again for making ASCRS the society it is. Without your involvement and support, I wouldn't be able to deliver these great updates. Thank you all for what you're doing, and I look forward to seeing many of you in person next month at the meeting in San Diego or at next month's update. Always remember, this is your specialty and ASCRS is your society. You are part of this 122-year legacy of surgeons who've made our specialty what it is today. And together, we will make it all that it can be tomorrow. Thank you.